We're back here on our program, this special edition of the platform, and we are talking about cervical cancer today. And as I said to the ladies during the commercial break, it's scary business for a whole lot of people because as you spoke and you talk about heavy bleeding and all of that, I'm sure that there are women who would have gone or are going through this. And so it is a bad sign, isn't it?
Yes, it is. A lot of women, though, you know, our population tend to, oh, we have abdominal pain, oh, that's gas. So a lot of women give reasons as to why they're bleeding heavy. And some of them may be good. I mean, if they're on contraceptives, the pill, the shot, all of them cause you to bleed. However, I still encourage my patients to still seek help from your gynecologist, because if it's abnormal for you, then for me, I try and do a pap smear, and I also do what we call an endometrial biopsy, because you may have a cancer higher up. So any lady that comes in with bleeding, I still do these tests to rule it out. And women just sit and they say, oh, well, it's from the pill or it's from that. So you can present with abnormal bleeding being bleeding between the periods, heavier than normal, clots, as she mentioned, bleeding after sex. Now, a lot of women come running for that because, of course, it messes up the bedroom. And so they come for that. But when you see you're at a point where you're bleeding heavily, in a lot of cases, you probably do have cancer. So it's very important to catch it before that. You understand? Because at this point, you're at least a stage 1. And I have had, I mean, we diagnose people quite often, and they come in with the same story. Also, women who have stopped bleeding, postmenopausal women.
So the incidence of cervical cancer is extremely high in this country.
It's the #1 cancer of the female reproductive tract.
The #1 cancer of the reproductive tract, but overall?
No, it's, well, of course, if you're looking at the male and female population, of course, those things like breasts and prostate comes before cervix cancer. In terms of new cases, in 2018, however, there were 10 more new cases of uterine cancer here in the Bahamas than cervix, but cervix is still the #1. It seems as though uterine is trying to increase. But that was just for the year of 2018.
So this is not one of these cancers where diet is extremely important and exercise, eh?
Well, diet is important in terms of keeping your immune system up. It's good to eat clean and don't smoke and that type of thing, because smoking increases your risk. So dieting is still important. It's not as important as the amount of partners or, you know, when you started your sexual career. It's not as, but it's still important, because when you have a weakened immune system, you can build up your immune system by the things that you eat. So.
And when you're talking about the number of partners, you're talking about a number of partners over a prolonged period of time.
From your first sexual encounter.
Yes.
Yes.
And it makes a difference.
Yes, absolutely. The more partners, it increases. And the partners that you have, they have partners. So.
But if you have partners who are not carrying a virus, then you're fine.
Yeah, but do you know who's carrying it or who doesn't?
No, I'm just making a point. So you can have multiple partners, and none of those partners are carrying the virus.
Yeah.
Yes.
But Mr. Jones,
that's a very slim chance.
That's a slim chance.
Remember, this one is very, a lot of people have it or carrying it and they don't know.
Yes. Right. And so it behooves you to go and get your pap smear, and to get, more importantly, to get the shot, to get the vaccine.
Yeah. Unfortunately, they don't have a screening test for the men. But if you have a new sexual partner, if I was a woman,
you'd make sure that he is screened.
What? Yeah, come, let's go.
Let's go to the doctor, babe. Come and get the vaccine.
Let's go. Yeah, I mean, just like any other sexually transmitted infection, if you have a new sexual partner, you would want to know what their status is.
So the partner doesn't necessarily have to have a venereal disease. Well, you consider that a venereal disease.
It's a sexually transmitted
A
infection.
sexually transmitted infection.
Yes.
All right. Which is...
Do they use venereal disease anymore? They don't know how to use that.
They don't use that term? But a disease is a disease.
You know, yeah, but it used to be sexually transmitted diseases, and now it's sexually transmitted infections.
Oh, I see.
Yes, it's milder.
It's milder.
Yes.
I see. But
Yes.
six or half a dozen, it's still the same thing, right?
Yes.
Right. So whether you have an infection or a disease, it's the same thing.
Yes, sir.
Yeah.
What is the cost for to get a pap smear or to get one of these shots?
I'm glad you asked. I often tell my women, it's about, well, the conventional pap, which is the traditional pap where you do the smear, right? That's about $50. All right? The thin prep, which is better in terms of the yield of cells, that may run you into maybe 100. All right? And I always tell women, I mean, either you go do your annual and do your pap for $50 to $100, or you pay for radiation that's $20,000. I mean, you choose which one.
How often should a woman get the vaccine?
No, the vaccine is, well,
It's 3 shots.
yeah.
3 shots. Okay, but how long does it last? You can just get
Yeah, you can get it, your booster, after 10 years.
after 10 years. So you should get it every 10 years then.
Well, I had 3.
You had 3.
No,
but you had to get
that's
3 because
that's
you
No,
That
that's
was
a dose.
afterwards.
Yeah, the vaccine
see.
is 3 doses.
okay.
Yeah.
3 doses of the vaccine.
Yes.
And that happens over a period of time?
6 months.
So you go every 6 months?
No, you have to have had the 3 of them within a
Within
6
6
month,
months.
within a 6-month period. So
All right.
you'll get one today, and you'll get one in another 2 months, and then within 6 months.
That is for men and women? Okay.
And then that could last 10 years.
Approximately.
Oh, okay.
Or, yeah.
Is that shot painful?
No, it is not.
Oh,
Well, some have complained. I mean, it's local. You'll get local effects. The redness, the tenderness, lump there, but
oh, so nothing really.
The first time it was horrible, but
Oh,
really?
I had a lump.
Oh, you did have a
I
lump.
couldn't use my arm the way I was used to using it. But the other 2 shots was like a breeze. I took so much injection, still it didn't even faze me anymore. And the radiation part of it, you know, I hear a lot of people say when they finish their treatments, they go to work. Me personally, I tried, but the radiation makes you very tired. I tried to exercise, I tried to do a lot of stuff, but after doing chemo every Tuesday and radiation every day, I couldn't make it. My boss told me not to come in that office until I get a clean bill of health.
oh, that's nice. So they're supportive.
Yes, that's my other support team, my family, my doctors first, my family, and my parents' oldest child. Never been a day sick. So every day of my treatment, my mother was there.
You mentioned that your grandmother had cervical cancer as
Yes,
well.
my grandmother had cervical cancer. She died maybe about 15 years ago.
The question is can this be hereditary?
It could be.
It could be hereditary?
Yeah, that's what I was saying when the back in the day when they used this particular drug.
Okay. But even today,
Well-
you can inherit this disease?
If her grandmother used, you said your mother also had it?
No,
and
my mother had a growth, but Dr. Butler detected that through a pap smear. But she went to Dr. Butler to have her annual. But my grandmother was sent to Dr. Butler after she passed a clot.
So it could have been
Yeah.
that she may have taken the medication.
Yeah.
It's a possibility. I don't know what her cell type was for her cervix cancer.
Yeah, but you see, first we said that the disease or the infection is caused by sexually transmitted. It's
Yes,
sexually transmitted.
80 to 90%.
80 to
yes.
90%.
And remember, I said a small portion.
A small portion.
Right. Could be passed on from mother or grandmother
Okay.
on, depending on if they used this medication during that time, during childbirth, or if they, I don't know.
And if you didn't use the medication, any medication?
Then maybe it was sexually transmitted
So it's
through all
either
of them.
through the use of medication
through
or
the DES, yeah.
DES?
Yeah, that's the name of the medication
Okay.
that they used back in the day.
Okay, and that's a long time ago.
Yeah, I think they're like, these women should be in their 70s maybe.
Are they still using that
70.
medication
No, no,
today?
no.
Or what are they using in place of that?
They have calcium channel blockers. They have different things to stop labor. Magnesium sulfate, but not DES. That's all.
Are those things?
If that causes the other medications cause abnormal paps?
Yes.
No,
Or bleeding?
no.
No? Okay.
Are people scared to get a pap smear because they don't know what it is?
I think, well, that could be, because I do have a lot of young patients that, and I asked them when the last pap smear was, they're like, what's that? So some of them don't know. And then I think, or I'm told, a lot of women, they are uncomfortable. They say it's uncomfortable. It's not that bad. You feel pressure. And basically it's, you may have a little cramping feeling. And other women just say they don't like the doctors to, have to do any examination down there. It's the same as men. They don't like to have their digital rectal exams for the prostate. I don't really think that there's the same stigma as it is with prostate, it is with us, unless their gynecologist is male and they have a problem with the male gynecologist. But if that's the case, just switch to a female.
Yeah. Tell me, other than seeing clots of blood, is this is cervical cancer detected by the naked eye or by the woman in any other means?
By the woman, the only other thing she may complain of is a discharge, a persistent discharge. Sometimes women with early cervical cancer may be treated like numerous times for either yeast infection, bacterial vaginosis. So they may have a persistent discharge, and we normally ask.
A persistent discharge.
Yeah, and it's foul smelling.
And
other than that, she may not know, and that she can tell. Now, for us as gynecologists, if you do a pelvic exam, and you can feel the mass there. But for the patient, it'll probably be abnormal bleeding and an abnormal discharge. Now, they may complain of pain, but that's more in an advanced stage of cancer. That's not the first sign that they'll complain of, it's the symptom they'll complain of.
Is there swelling of the stomach or anything such?
Again, it has to be advanced.
If it is swelling of the stomach.
Yeah.
If you see swelling of the stomach, it's advanced. You're talking about
Stage 3 and 4.
Three and four. And that is when it's very...
Even in uterine cancer, you may not necessarily get a mass first. They're going to complain of bleeding. And then as they get a little more advanced, depending on the type, then you may see a mass, or you may feel, the patient may say, oh, I felt like my belly getting bigger or whatever, but yeah.
So when there's Breast Cancer Awareness Month, we always see a lot of fundraisers to walk and a lot of charity events and stuff, and everybody knows that it's a good reminder to wear pink and you know, so it's always kind of in your face to remind you to get your breasts examined. But I didn't know actually that this was Cervical Cancer Month, the month of January, nor about the teal ribbon, and I don't really see a lot of people doing a lot of things. Is there stuff going on the island to raise funds or make people more aware that this is the month for cervical cancer?
That's a very interesting question. I started to do something about it last year. Spearheaded an awareness campaign. Kind of started when the month started. So I was unable to get sponsors. So I kind of did it out of my pocket. Did teal ribbons. Last year I put it in the Shell gas stations, and I think it was the Esso. And then the clinics, we did that. And I did lots of talks on cervical cancer last year on the radio. I have a women's Facebook page, Women's Health Tips and Q&A. Mm-hmm. I put a lot of stuff up on social media. And then we had a teal tea party, which was very good. It was a huge success. This year, I wanted to do something bigger, and we reached out to several corporate sponsors, but got no response. Mm. Or I should say one person, but you know. So it's, a lot of them say they already did their cancer. I think some of the corporate sponsors do a cancer, overall cancer, and in a lot of cases it's breasts. And so, and it was very disheartening because cervix is, after breast, cervix is the #1 cancer of the female reproductive tract. Mm.
Dr. Graham, you know, there are many women who are listening to you, watching this program, who they would like to have these various examinations, pap smears. Mm-hmm. They're not able to afford it. Mm-hmm. Believe it or not, it's a small amount of money. Mm-hmm. But there are many women who simply aren't able to afford these things. Mm-hmm. Don't you need a program in the country where people are able to access care and get these examinations and get these shots or
the examination at the pap smears?
Yes.
There is a need for a nationwide campaign for cervical cancer, but it has to come through Parliament. Mm. I reviewed places like Australia and England, and it is something that must be done, and it has to have a proper call and recall system. Because I remember telling my boss, I was like, can't we have this a must? Like, you know, if you want to get a house, you have to have life insurance. You know, why can't this be a must? Because it's a huge economic burden when you have to treat somebody with cervical cancer and it's preventable.
Yes, and so there has to be, we need to find ways to prevent it. Yes. And prevention begins by getting regular checkups, right?
Yes.
And so we need to find the means or ways and means to have women who are able to access care, and even if they don't have even if they can't afford it.
Yeah, even, you know, I was saying some of the insurance companies, there should be some incentive. You know, if you do your pap smear, then, you know, I don't know. I think it's more that the corporate Bahamas can do as an incentive or to encourage women to get their pap smears. Mm. It's the only preventable one.
You're talking about primary care in the country and the extent to which primary care ought to be accessible by the majority of the people. Mm-hmm. And
I think it should be, whereas when you go to the clinics, You get free antenatal aid.
Well, you can go
It
to the
should be
clinic
as
and get
simple
your
as
pap
that.
smear, you know. You
Yeah.
can go to the normal clinic and get your pap smear. All right, as if they're going to be willing to go.
Yeah.
The Cancer Society used to do pap smear drives every year. I used to be involved with it in my earlier years as a physician. And every year, the same women would come for their pap smears.
So it has to do with education, the extent to
Yes.
which you are not properly educating the population on
the importance
Yes.
of the pap smear
Yeah.
in
A lot of
prevention.
people, a lot of women, they say they don't want anybody to have a pity party on them. But it's no shame in saying, okay, you had cancer, you survived it. People will look at me and they be like, if you didn't say that, you would never know. But if I had not gone, I would have not been here.
Yeah.
So
have to-
it's no
they have to
shame.
go.
Sickness is for anybody. And nobody's exempt from it.
Yes.
Don't wait until it get to your doorstep before you encourage your sisters, your aunts, your mothers to go and get a pap smear. I think the government clinic is what, $15 to see the doctor?
Yeah.
Go and get a pap smear. You can't be too ashamed.
And
When you have to
our
fight for your
women-
life,
Yeah.
you're going to be afraid to fight for your life?
And you can just do it once a year.
Yeah. And our women, we find money for what we want.
Thank you.
So you need to make this top on your list to do your pap smear. You can find it.
Okay, let's take a final break here on our program, and we'll come right back.